Hi, it's Tom here from Running Physio. Today, I wanted to talk to you about a question that keeps being raised and discussed quite a bit on social media, which is how important is strength in running injury? How important is it in the lead up to running injury? And do we actually need to address it when we're treating running injury? As ever, I've put a link to our free webinars. We're getting some great feedback on those. We've got a great series on iliotibial band syndrome. We've also got videos on Achilles tendinopathy and lower back pain in athletes. So do check those out if you want to learn more about management of running injury. So let's talk about this topic of strength and running injury. And where the confusion lies. Now, I think for some time we felt quite confident that strength was really important, that if someone was weak, it may lead to running injury. And if someone presents to us with a running injury, that it's important that we get them as strong as possible. Now, that sort of still fits my biases. I do feel that may well be the case. But when you look at the research, it doesn't really support that. Now, prospective studies have actually looked at this and they found very limited evidence to show that lack of strength actually leads to running injury. We've also got research that has actually found you can improve pain and function in runners without improving strength. Things like J.F. Esculia's work in runners with patellofemoral pain. Simply educating them about pain and load management helped to improve pain and function. And adding strength work in that study didn't seem to lead to any significant improvements in symptoms above simple education alone. And then we've got a new paper that's come out from Dylan et al. That's created some waves on social media as well. Now, this paper that's just been published tried to compare different groups of runners. Ones that had what they call acquired injury resistance, so they hadn't been injured for 2 years. Ones that had never been injured, and a group of recently injured runners. And they actually found that the recently injured runners had higher levels of strength in the hip abductors and plantar flexors. Now, this is a bit of a spanner in the works then, if we think that strength is important in running injury. How come these recently injured runners are actually stronger than those that have never been injured? Now, if we take these studies at face value, we might dismiss strength. We might think it doesn't have a role in either injury development and may not even have a role in the treatment of injury too. But that's where it's really important that we dig into the research a little bit more and we're aware of the limitations of the research. So, for example, those prospective studies, the ones that are often helpful for approximating the cause of an injury, they have some big limitations. In particular, they quite often just measure strength once at baseline and then go on to see if it's connected to injury development over the next year or two. Whereas actually, it's quite likely that strength fluctuates, and there is some research showing that strength may reduce just prior to injury, which isn't going to be captured if you're only measuring at baseline. So I wouldn't use those studies to say that strength or lack of strength cannot be a factor in the development of running injury. And then this most recent study by Dylan et al. Has some really significant limitations. And this again highlights why just reading the headlines doesn't really tell you what's going on. So this group of what they call recently injured runners, actually, they had their injury at least 3 to 12 months ago. So they've not actually been injured recently, and 87% of them had completed a rehab program. So actually, it might be more appropriate to call them recently rehabbed runners. So when you look at it in that context, then this group of recently rehab runners, yeah, they're a bit stronger in their hip and they're a bit stronger in their calf than runners that have never been injured and haven't done any rehab. That's not really surprising. So I think we have to look at these studies and say, well, this doesn't really tell us a great deal. And in fact, really, when you look at all the runners in that group, none of them are currently injured. So when you compare three groups of non-injured runners, it's not a great surprise. They're not greatly different. So I'd say we need, first of all, to be a bit cautious about the research. Be prepared to delve into it in a little bit more detail and be aware of those limitations, so we're not kind of throwing the baby out with the bathwater with this and dismissing strength altogether. We do also have some good evidence that there can be a lack of strength following injury, and this may then impact function. So, for example, in Achilles tendinopathy, there's evidence of calf weakness, particularly soleus weakness in runners with Achilles tendinopathy, and evidence of weakness at the level of the hip in runners with Achilles tendinopathy too, and hip abductors and extensors. So we know that these strength deficits can exist. We don't know exactly whether these strength deficits can cause injury. There just isn't enough good evidence looking at strength changes over time to tell us that. We don't know exactly whether strength training actually reduces running injury risk. And again, this is because the evidence isn't very strong. When you look at the studies that have actually examined it, they often aren't really looking at a strength training protocol. They're often cardiovascular based exercises without sufficient load. So they're not really testing it out. So I think it's fair to say at the moment, in terms of the development of injury and in terms of whether strength training can prevent injury in runners, we don't know. We have our theories, but we don't know yet. And I wouldn't throw the baby out with the bathwater with it. When it comes to treatment of running injury, though, I do think if there are strength deficits there, we should consider addressing them with each individual. So I think really where strength probably has its biggest role is perhaps more in the treatment of injury, where it's a little bit more murky as to whether lack of strength leads to injury or whether strengthening can prevent running injury in runners in the first place. So a few take-home messages from you for this. First up, be aware that the research is fairly mixed and inconclusive. So let's not write things off altogether, but also let's be aware too that strength work is not a panacea. It's not going to fix everything. We can't just assume that it's going to prevent the development of injuries or that it's essential for every runner. I do think it makes sense to assess it and address it as part of rehab. And that involves your clinical reasoning and your judgment and working closely with the patient. Does the strength deficit that you've identified, does it seem to actually be relevant to the pain and pathology? So we come back to soleus weakness in Achilles tendinopathy. Yes, yeah, there's, it makes sense that if the calf complex is weak, that's going to have an impact on a runner with Achilles tendinopathy, particularly when we know that the calf load during running is particularly high. So we can reason through that connection and we can justify then strengthening up the calf complex in a runner with Achilles tendinopathy. And that's then supported by research. When you look at studies like Bayer et al. And Sancho et al.'s work, strengthening the calf does seem to be important in that group. So we want to assess it and address it and consider whether it's relevant to that patient. But also, I think we need to be quite flexible in our thinking. And not every runner needs to do strength exercises. It's okay sometimes not to send someone off with exercises. Sometimes it can be more appropriate to say, well, let's just look at your load management. I tested you out. You're actually pretty strong in these key muscle groups. Particularly I'd look at quads, hamstrings, glutes, and calf. And you're thinking, okay, well, this is not a weak runner, and tell them that, build on those positives, tell them they're in great shape. But perhaps their assessment has shown you that they've just spiked their training load far too much, or there's inadequate recovery. And you might say to the runner, let's not worry too much about throwing in loads of exercises for you at the moment. Let's look at your training load. Let's bring in a little bit more recovery for you. And actually, let's focus on that. And that's less homework for them to do. That's less of a burden for them. And this can be particularly important in people that have already got a big life load. They've got loads going on in their life, and trying to squeeze in extra exercises actually might just add to fatigue and may actually not be that helpful for them. So I think we need to be flexible in it. Be prepared sometimes to not give out exercises and don't feel under pressure that you need to do that for every runner. Also, I think we need to be realistic with our strength goals. And we need to be quite careful that they're not a barrier to return to running. Because we've felt that strength is so important in running injury for such a long time, there are actually now in place sometimes quite difficult goals that people need to achieve before they're allowed to return to running. A runner recently was talking to me and said was told he had to do 50 calf raises on each leg before he could return to running. Now, that a lot of runners aren't going to get even close to that. I can't get close to that. I might be happy to get half of that. So let's not make these strength goals an unnecessary barrier to return to sport. The evidence doesn't support that. We're not in a position where we can say you must tick these boxes in terms of strength before you can get back. Instead, let's be guided by their irritability, so how easy the symptoms are to stir up, the stage of their injury and their response to loading. If they can tell you that they can manage some running without a lasting aggravation, get them running if it's appropriate for the injury and the stage of the season that they're at, the stage of recovery they're at with that particular injury. So that's something I'd like you to take away. Let's not use strength tests as a barrier to return to sport. And then lastly with this, I think when we think about developing strength through strength exercises, let's think beyond just getting stronger. We see in studies like the LEAP trial in gluteal tendinopathy that symptoms actually improve before there's any change in strength. So it might be the act of strengthening, the process of doing it, that helps to reduce pain, that helps perhaps have some positive effects on tissue function, that may also help the patient's confidence. And we can see improvements actually before strength is increased. And bear in mind the secondary benefits of our strength training too. It has been found in runners to improve both running economy and performance and doesn't tend to increase body mass. So there's lots of benefits even beyond progressing strength. But I think we really need to work with each person on an individual level, work out what you think is needed for them, and be prepared sometimes to actually say, strength is not that key for you at the moment. Let's focus on other areas. Okay, thank you very much for listening. I hope you found this useful. I think it's a good area to read around and keep our minds quite open with it. And just to kind of summarize what we've said there, it isn't really clear whether strength or lack of strength leads to running injury. We don't have strong evidence to show that strength training reduces injury risk specific to runners, but I do think it's something we should assess and consider addressing in individuals who are injured, and then see actually when working closely with the athlete if it's going to be helpful for them to work on strength, but be prepared sometimes to consider other options. Not everyone needs to be spending lots of time trying to get strong. Okay, I hope you've enjoyed this today. I look forward to your questions and comments and replies. Do check out those webinars that we've linked to. We're getting great feedback on those, and I look forward to speaking to you next time. Bye for now.